Got this email, rad@radradio.com from Nicole.
Hey, Nicole.
And she says, I've always wondered what happens when Rob presses the commercial button. Do you guys continue laughing at, say, a dumb caller, as an example? Does Rob press the button and everyone goes straight face and turns to their phone or their book or their food? I always thought it would be a mystery I can't wait to watch beginning Monday. Yeah, Rad TV will launch on Monday for members at members.radradio.com. In fact, we've got like 36 people in the beta that are all part of either the family or our inner circle or Tech to You that have been watching for the last week and a half that are helping us and giving us feedback. And in fact, we have Dr. Patel from Granite Bay Allergy in the studio with us. Good morning. And Dawn came in and they started talking about some very personal medical issues. And I pointed out to Dawn, I said, now you realize the 36 people that may or may not have heard that conversation right now, that's fine. But on Monday, it could be thousands of people that you're sharing these things with. So there will, and in fact, her other example, when we did jokes from the maggots, after we got done, we went to commercial. As Dawn was walking out of the studio, I then explained in very graphic fashion what the joke meant in a way that you can't do on the air. So all those things will be available.
Ooh, wait till you see what I do every commercial break.
Yeah, she
really
leaves.
Interesting.
Leave the room.
So interesting.
Basically, but there are those little highlights, like her sharing her next 3 months of medical treatments. So, Dr. Patel, we're going to throw you right into the deep end here. We got a bunch of emails here, rad@radradio.com. You can always call 888-989-9811. Let's start with this question leads us into the overall description of what makes you different and what you're doing and how you do it in some ways. Dwayne wrote in and says, I've had allergies my whole life. Never mattered where I lived, with or without animals. I went through treatment, did 5 years of shots. It got better, but still had a horrible post-nasal drip. Then COVID hit, and they stopped doing the shots. Within a month, my allergies were back full bore. Any ideas? Now, is this that treatment? This is not the treatment that you do, right? What he's describing?
Similar. The big difference is that, depending on dosing, and it all got standardized up in 2011, essentially people in the past where we say, treatment failures, are not necessarily treatment failures. It's about dosing, right? So now that it's standardized, the dosing is anywhere from 100 to 1,000 times higher than it was before. So people who, typically we always say, people in the past on the lower dose ones, they improved but never resolved.
That's what I had, right?
Yeah.
Back in the ancient times in the late 70s and the early 80s, when I was getting shots every week, that's what I was.
Yeah, pretty much. Yeah, so you improve while you're on them. When you stop, within 5 years, you're kind of back to the way you were before. Now with the standardized guidelines, as long as people guideline dose, then you expect much better response, right? I mean, most people are symptom free, within 3 to 5 years, and they stay in usually like a lifelong remission kind of a state.
So if they get to symptom free in 3 to 5 years in your system, they're usually that's it. They don't. Now, if they move, they might experience some changes when they move because they might be surrounded by new things.
Yeah. So the whole idea is immunotherapy. So it changes the way your immune system responds. So not only will it take care of the ones you have, but it also changes the way your immune system responds. So let's say without therapy, maybe you develop like 10 allergies a year, right? After immunotherapy, you may develop like 1 or 2 allergies a year.
Oh God.
And if it takes you like a lifetime, let's say it takes you 20, 30 years to get to a place where you want to get treatment. Well, if you're back down to like almost none, and then it takes another 10, 20 years, even if you move to a new area, you may develop some new allergies, but it'll never be significant enough that you need treatment for it.
Now, when I start with the allergy thing, I'm always talking the traditional achoo allergies because we also have the food thing and all these other things.
Yeah.
But when we stay with the achoo, there's people like me who kind of have them year round because there's so many various things maybe. And then there's seasonal allergies that people notice a lot in the spring. But there's also, a lot of people don't think, there are actually winter allergies, correct?
Correct, yeah. Winter would be like mold, like, in California, it's like the rainy season, right? So in our rainy season, it's mold, and then indoor things because you're indoors more, right? Dust mites and animals and things like that.
All that fun stuff.
Yeah, that sounds lovely.
So when people suddenly feel like they're having these reactions in the wintertime, a lot of people they jump to, I'm getting a cold, but then when they notice it happens every year, it could just be you're allergic to things that only pop up in the winter. And you would be able to identify that and then treat them for that so that in future winters it wouldn't happen.
Yeah, correct. I mean, colds you can easily tell, if you have a fever, or sore throat that without itching, then it's more likely to be a cold, right? And they're self-limited. Colds are 7 to 10 days, most people.
The problem is, though, we notice that people don't go to allergies a lot, right? They I don't know if they want it to be a cold because it's more dramatic, or you get more sympathy.
Well, and a cold goes away.
Right.
Like he said,
Exactly.
right?
Yeah.
And whereas allergies, they're with you unless you go to someone like Dr. Patel and then go through all the treatment.
Well, and the thing is, and as I read through all these emails that we've been getting, it's like I wonder how many people, like Dawn, have lived with these various things for years where... First of all, now Dawn was thinking she was allergic to animals, and it turns out it's not. Or so the thing she was turned out it's the opposite. You are allergic to animals.
I for sure thought cats, but none of the others. I'm basically
Right.
allergic to every animal. And then gluten, I thought I was.
And it turned out not.
Not at no, I'm not. I have 0 food allergies.
So there's that, and then there's the version where I think people are walking around uncomfortable, and they don't even give allergies a thought because they think only at shoe allergy. Because there's so many emails that we get where we go, no, Patel could figure this out. I don't know how we convey that to people, that if you've got a chronic problem, it may be something that's more in your line of work.
Easiest way I tell people is like, oftentimes I hear people like, oh, I have bronchitis all the time. They're like, oh, I got bronchitis again. I'm like, oh, yeah, do you have an immune deficiency? Probably not. I mean, you can always look at that. But oftentimes, if you have something, again, that's more than a week or two long and it keeps happening, then it's most likely, some kind of allergic bronchitis or, there's other factors, but most commonly it's like an allergy.
And also, I've got to thank you for making me look like a hero, because sometimes it's just a matter of finding the right doctor. My friend Al came to see you a few weeks ago, and I know he's working through the program now for the testing, but just by you changing, he won't mind me saying he's got asthma, you changed his inhaler. It's night and day.
Wow.
I mean, he's not an emotional guy, and he was like almost emotional in his text to me that he can breathe, and his life changed with that change of an inhaler, just you identifying that. I mean, that's extraordinary.
Yeah.
I'm glad.
Yeah.
Well, I mean, when you get the news, like, I mean, I never stopped having cats, even though they make my eyes itch and everything in flames, and it can get uncomfortable. But to hear that at some point you can overcome that, the 3 to 5 years or whatever it is, that's such good news for animal lovers, because there are so many people out. I'm a glutton for punishment. I'll just have the animals, but there's so many people that don't.
But you're not a gluten for punishment.
No, but there's so many people that won't because of it.
We got this email from Michelle. She says, I got scratch tests done almost 10 years ago. What the hell's that?
It's like a percutaneous, meaning just like on top of the skin.
That said I was allergic to everything but mold and roaches. And by everything, I mean dogs, cats, every tree, every weed, and all the grass that grows where I live. That means I've been getting multiple shots every month since then. My doctor seems to be content to keep going as we are. Is this normal? Should I ask him to test me again to see if this is doing anything? I still get congestion and have to take an over-the-counter allergy pill every few days on top of the shots. I'm not giving up my dogs or cats so they'd be bringing their issues with us. Yeah. I'm just really getting sick of being a pincushion and having to make sure I plan trips around shots so I don't have to go back on maintenance.
Yeah, that goes back to exactly what you were saying at the beginning of the show, right? Where you said, hey, a low dose versus high dose, guideline dosing versus more water, essentially, kind of a thing. So, a lot of those people, I mean, I would say pretty much all of them have been, non-guideline dose, but
so
once you move up.
If she were to come to you, would you start over? Would you just say, yeah, we need to start over. I'm going to first find out. I'm going to confirm what you're allergic to, and then we're going to go through my program.
Yeah, we'd look again just to make sure. But if she had an allergy to everything before, we could always use that too, right? I mean, if there were any gaps, we'd check those. But if it was everything, then, we just treat it with everything again. But dose higher.
Is a scratch test reliable enough that she got good results?
Yeah, so usually we do scratch tests first, and then if you're an adult, we may do some intradermal testing, which is like like TB tests, if we need to.
So she is probably allergic to all of this stuff.
Yeah, she is. She probably just needs to be dosed.
Phone number is 888-989-9811. Hello, Charlie.
Yeah, hey, anybody?
Hey.
Hi, Dr. Patel.
Hey, how you doing?
I was calling in today just because I had, obviously Dr. Patel's there. I had this really weird allergy that, I had been like 155 pounds my entire life, and I messed my leg up real bad, and I was bedridden for 7 months. And during that period of time, I had developed like a weird allergy to gluten. I had also gained 113 pounds because I was unable to be super mobile. And I had overheard Dawn saying that she'd always thought she was allergic to gluten. And this isn't me being a smartass in any way. I apologize for that. But when I was overweight, I did have some kind of weird allergy to gluten. And I was wondering maybe if that's why, Dawn, like, do you ever have, like, indigestion and heartburn after eating gluten?
No, not anymore. It was all very mental. I mentally had talked myself into that's what it is, because I would break out in rash, this or that, not realizing I was just dealing with the horse or a dog or an animal, not putting the two together that's what it was.
Because the brain doesn't work that way.
Mentally convinced myself, and the minute I knew I wasn't, no, I eat gluten all the time, and I have zero indigestion, heartburn, anything.
And I
have no reaction.
This guy, Dr. Patel, he could be doing the same thing that Dawn was doing, where he thinks he's having a reaction to gluten, but it's actually something totally unrelated that he's not connecting the dots on.
Yeah, there's two different things. There's two schools of thought, right? So when people remove gluten from their diet, they're drastically changing their diet, right? So gluten's in fast food, it's in microwave meals, all that stuff, right? When you remove gluten, all of a sudden you're eating fresh food, you're eating nice, good meal, good meat, good everything. Is it really the lack of gluten, or now you're eating a much healthier meal? And now all of a sudden you're eating healthier, you feel better, you're working out more, you're losing the weight. There are other factors that really play a big role. And in my perspective, it's like, I don't really care what you have to tell yourself to not, to lose the weight and eat better. If it takes, hey, I'm gluten's a problem, like, hey, go for it. But if it's anything else, just lifestyle.
So in Dawn's example it turns out there is an allergy to animals, right?
Yes,
okay.
I'm allergic. Yeah.
And you're going to treat that when it's time.
Yep.
There can also be the opposite too. People, right? Correct. People can think they're allergic to animals, but it's actually nothing to do with animals.
Correct. Exactly.
And that's the whole point of getting the test, because we got this email just now from Araceli. She says, what's the treatment for animal allergies if we don't want to get rid of our animals? We have 3 dogs and a cat. I think about all the people that have gotten rid of animals because they think they were allergic to their pets.
That's why I was saying earlier,
and they weren't.
I'm happy for, I place no judgment that I've just continue to surround myself with animals, because it can be a really hard thing for people. I'm excited that they can find out you actually don't have to get rid of your animals, or you can finally, after you have treatment, get a dog, right? Your whole life you haven't been able to.
So the steps there are, first, confirm what you're allergic to.
Correct.
Don't just assume that you're allergic to animals because you're sneezing every time you're around your pets. And then there is a treat if it's you're allergic, like Dawn's allergic to animals, so you're going to treat her. That can be treated in the way that you're discussing.
Oh, it's funny. It's like, actually, I stopped telling people to get rid of animals now, because I love animals too.
Yeah.
So it's like, what are you going to say? Oh, get rid of your child, right?
Right.
So
Exactly.
oh yeah, get rid of your kid. Making your kids making you have a stuffy nose. Right? It's like, no. So I'm like, all right, textbooks say get rid of the animals, but that's not going to happen. So we're like, all right, we'll get around it. We'll change it so you don't have the allergy.
Here's a classic. We talked about this the very first time you were on, but it's always good to remind people. Elena wrote in, said, is there any truth to taking local bee pollen or honey to eventually prevent your allergies?
Nope. Nope. Quick answer is nope. And, as we talked about before, the pollen that bees collect is non-allergenic. It's from animal pollinated plants and flowering trees. And the pollen that causes allergy is airborne, which is not what bees have.
Now, that caused a lot. I mean, that helped make, I can't even talk. It was less work now, because I'd be on the hunt for local honey. And sometimes it could be a pain in the booty, unless you find that person, and it's like, okay, well, now I don't have to.
Now you just get the best
now you
tasting
just get
stuff.
whatever stuff
If you're lucky enough to have a friend that lives in Utah where they make the best honey, you just have him buy it by the tub and ship it to you. As a random example.
No, honey's good for a lot of stuff. And I think I told you before, there's been some studies with dementia and honey helping that, and honey has a lot of and actually, honey is one of the few things that was studied to find virus. When you get a cold virus, we're in viral season now, right? So the only 2 things that were shown to help was honey and herbal tea, right? They looked at vitamin C, echinacea, zinc, all that stuff. None of that stuff made a difference. Except psychologically.
And they added whiskey, right?
Yeah, right. A little bit of whiskey, a little shot.
But is there,
we're not anti-honey on the show.
Yeah.
It's just we like to just clear up that there's no connection.
Is there any truth then? It's got to be raw honey, because that's all I'll buy now, and am I just wasting money?
Yeah, I don't know. The study was the studies that I'm looking at. It was like a big what we call a Cochrane review, where they look at all the studies and they put them all together.
Yeah.
And on that, they found it was just honey and herbal tea. They didn't say what kind.
What kind?
Yeah.
Okay.
Now, I think the last time you were on, we discussed a little bit that there can be a connection, right, between the earwax buildup that people get and allergies or immune deficiencies.
Earwax. If you have infections, recurrent infections, you can have irritation and more earwax.
So Christina wrote in and wanted, and you, to the extent you want to explain what this is, she wants to know what you think about ear candling. Is it all hype or can it work for some people?
No, I mean, I think as far as I know, I'm not like an expert in ear candling, but I thought it was like, isn't it like just melts
Yeah.
the earwax, right?
Yeah.
It's like, yeah. So I mean, I don't think it's any difference than putting eardrops in.
It's an extraction
Yeah,
method.
exactly. Yeah, so I don't know.
But you're not treating what's causing it.
Yeah.
Yeah. Hello there, Sarah. Go ahead.
I have a question. I'm an adult, 40s, started using cannabis about 4 years ago for PTSD. And I've noticed I've always had allergies. I've always had postnasal drip. I've always been kind of stuffed up all the time. But it's definitely gotten worse since I've used it. I don't always smoke. It's sometimes edibles, and it still seems to affect. Do you guys test for cannabis allergies?
So easiest way actually. Most of the time, what we do is called a prick to prick. So people just bring in the cannabis, and we can test that against them. So interesting is there have been papers written in the last year about the uptake in asthma flares with people who live next to marijuana farms. Oh, wow. So what happens is it is very allergenic, and twice a year, because it actually pollinates twice a year, I guess, in a lot of flares and ER visits. So Canada just recently legalized nationwide. So we expect, hopefully in the next few years, maybe there'll be an extract that a company will produce. So in the U.S., unfortunately, because it's federally illegal, there's no company that can make the extract to basically treat, because then they'll get shut down. So you can get local, but then year after year, there's no way to secure the same concentration, same everything to treat. But basically, the theory is all, sublingual drops or allergy shots basically would desensitize you to it. And we have a lot of patients who, when they have their own farm or they have their own plants in their house or in their backyard, we say, hey, during the season or when it's going to pollinate, you have to keep everything shut, run air purifiers, do all that. And as far as your case is, anything inhalation is bad. Edibles cannot cause allergy. In fact, it can do the opposite, right? It can actually help desensitize you in a way to that. So,
hello there, Frank. Go ahead.
Hi. So my wife and I, she's actually taking her allergy shots right now for the last couple months. And I have a question as far as we want to try and have another kid, hopefully soon, but we want to know when it's safe, and we spoke with her allergy doctor a little bit, but is it safe to start trying while she's on her highest dosage, or when she reaches her, I would guess, the minimal stage where they just do it once every other week?
Yeah, so this is a very common question and well studied in terms of once you get pregnant, they keep you at the same dose. That becomes your maintenance dose. If you're at the full dose, once a month, then they'll just keep you at that. If you haven't reached that yet, they basically hold you until you deliver. And then once you deliver, then you're fine. So the shot itself is actually not real medicine, right? It's the same things you're allergic to, injected under your skin. That way you build up an immunity to it. The risk with pregnancy is like if you have a reaction, then you have to treat that with epinephrine, which can decrease blood flow to the placenta, right? Oh. So that's what the theoretical risk is. So when you stay at the same dose, the risk of reaction is extremely low. And that's why they say it's safe to continue. So then you just kind of make up after you deliver.
Talking with Dr. Patel from GraniteBayAllergy.com. We got this email from Na.
Hi, Na.
She says, I am wondering, how are eczema, rosacea, and psoriasis similar and different? Are they all related to allergies? I'm asking because I have all three.
Whoa.
And a dermatologist has given me 3 different medications for them. I'm wondering if there is a more simple way to reduce all 3 different issues at the same time.
So rosacea and psoriasis are more on the autoimmune side, and they're not allergy-related at all. Usually, psoriasis and eczema are kind of opposites, right? It gets more complicated, but the part of your immune system that skews between, let's call it TH1 and TH2. TH2 is more the allergy side, and TH1 is more on the non-allergy side. And basically what happens is when you skew one way or the other, your immune system does one or the other. So it's very rare to have both.
So she won the jackpot to have all three.
You're special.
Because only eczema is the other side.
Exactly.
Is what you deal with.
Yeah, eczema is completely allergy. Allergy shots and immunotherapy is a known treatment. Again, eczema is topical, treat the symptoms, or get rid of the cause, which are the allergens.
So that you could help with over time. The other two, she's going to have.
The other two, yeah.
Well, maybe it'll feel better with just the two.
God. We got this from Meg.
Hi, Meg.
Shut up, Meg.
Says I was diagnosed with celiac disease 2 years ago. Are there any treatment options for someone like me who desperately loves and misses Scotch whiskey and donuts, but can no longer partake without horrible consequences?
Unfortunately, no. For celiac disease, you have to avoid all gluten whatsoever.
And that presumes that she was diagnosed correctly.
Correct.
Not
Exactly.
some doctor just saying, yeah, you got celiac. Because there is an actual test.
Yeah, there's a blood test if you eat it, and then the gold standard is a biopsy.
Because we have endless people walking around this country saying they have celiac disease.
Yeah.
They've never even been tested for it.
Exactly.
Yeah, one of my girlfriends, she was tested for it, and yeah, she has it bad. And yeah, I'm hearing what she's saying in the sense of like there are times I've made cupcakes and there'll be 3 different flavors, and she's like, which one's going to be worth it for me to be spending like all that time in the bathroom? Because I guess it gets pretty painful if you go ahead and eat it.
We got this email from Randy. Says, I believe I have an allergy to alcohol. My face gets red around my eyes, sides of my nose, down my neck, and under my chin. It's warm to the touch and itchy. It happens with all alcohol, but it doesn't happen all the time. This could be a dosage issue. Other than the obvious, what do you suggest I do? I don't drink often, but on the occasion that I do, it's uncomfortable, and everyone can see that there is a reaction of some sort happening.
So couple of things I think we talked about before, but one, it could be a sulfite thing. Again, actually, funny thing you're joking about it, but it is dose dependent. All right, if it's a sulfite sensitivity, or if he has asthma, if he has polyps, there could be something called AERD, which is aspirin exacerbated respiratory disease. In which case, you can actually desensitize to aspirin to get rid of the alcohol issue too. So.
You can plan on the question of alcohol-related problems coming up every time you're on this show. I'm just warning you. And now that the marijuana thing's out of the bag, that's going to keep coming up. Do you find it yet? Hello, Hillary. Good morning.
Hi, good morning.
Hi there.
I was calling because my 4-year-old daughter was recently diagnosed with alopecia, and it is progressing like really, really fast. And I'm just wondering if there's anything that we can do besides the steroids and the Rogaine to try and look at it. I know that celiac sometimes is affiliated with it. It doesn't seem like she has celiac, but I didn't know if there's anything else that we can look into.
Now, alopecia ends up, it's really unknown exactly why it happens, probably more on the side of autoimmune. But, a lot of kids do outgrow it. So it depends on, is it universalis? Is it like areata? What kind of alopecia it is, too.
We got this one from Mick.
Hi, Mick.
Says, I've been struggling with EOE for almost 20 years. I've been tested several times, and each time have a huge reaction to wheat. Basically, my only options are to avoid all things wheat, and that sucks.
Yeah, so EOE is eosinophilic esophagitis. So
oh, yeah. I knew that.
Basically, I know. Wow, it's like common knowledge, right? No. So it's basically like an asthma of the esophagus. So there's lots of treatments. So the thing about that is where I train, University of Pennsylvania, is one of the best EOE places in the world. So we actually did a lot of studies on this and essentially wrote part of the textbook for EOE. There's immunotherapy helps. There's topical things. There's actually a lot that EOE. There's a lot of treatment things, and it's like a hot topic right now in the last 10 years, where there's a lot more now that we know and do that we couldn't do before. And every year it changes. Like, I'll see someone now and then I'll see him again next year. I'm like, oh, well, things we talked about last year, well, there's more now we can do, and there's more things to get rid of it. And
so he's not destined to never eat wheat again.
Oh,
There's all sorts of things that he could try.
Lots of things.
Okay.
Yeah.
GranitePayAllergy.com, dude. Seriously. This is from Nancy.
Hi, Nancy.
Curious what the doctor would say about an allergy to shrimp, not seafood. I can eat anything else that comes from the sea, but I get hives the size of quarters all over my head, arms, and torso, but not my legs when I eat only shrimp.
Wow.
It would depend. Like, is it just shrimp? Like, what about other crustaceans too? So, when it comes to seafood allergies, 3 groups. There's fin fish, which is regular fish, and there's crustaceans and mollusks. Typically, people have an allergy to one group and not all groups. And then also, remember, if it's adult onset, then I'd, again, question whether you even have the allergy. That syndrome we talked about before, which is dust mite crustacean mollusk syndrome, where if you're really allergic to dust mites, the protein called tropomyosin is found in seafood and or shellfish, and primarily it's in shrimp is the highest concentration, followed by crab, followed by lobster. But then if that's, again, dose dependent, and it depends on how much exposure she's had there, dust and things like that.
I wonder if it's jumbo shrimp that's giving her the problem, because she might be allergic to oxymorons.
Oh my God. We got this note from Jesse. Jesse says, when I eat spicy foods, I get a few small bumps in front of my tonsils that if I push on them, they will pop.
What?
Yum.
What?
And then Jesse says, what the hell is that? Yeah, no kidding.
No, that would freak me out.
Well, we'd have to investigate way more than that.
What,
but
you can't diagnose based on that? You can't-
I'm like a bumpitis. No,
Oh my God! In the
bumpitis.
meantime, stop eating it.
and stop push. Wouldn't we say stop pushing on the bumps too by the tonsils and making them burst?
Well, yeah, it could be a spice. A spice. You can test for spices and things like that.
Oh,
so.
I thought he said spider.
Oh,
My God.
Like, it couldn't be like a condition that he has that's triggered by the spicy food, maybe?
could be, or it could be the spicy food. Some spices can cause allergies too, so it all depends.
Samantha says, for the last 3 years, I've been getting red, raised, itchy bumps only on my elbows. It lasts for about a week, then goes away for months before it happens again. What could this be, and what can I put on it or do to stop the itch and make it go away?
Aging.
That's
So that one, it could be like something called pressure urticaria, or it could be eczema, or an irritant dermatitis, irritant contact dermatitis. Elbows, lots of friction. You touch a lot of things, pushes on things.
And you can get all this in just localized spots like that.
Yeah, just localized spots, depending on where it's exposed, what is exposed to, what she's doing, things like that.
And so we start with getting in there, see you, get evaluated, start the testing if necessary, and then figure out how to treat it.
Yeah, and I mean, she could always try antihistamines at home and see if that makes a difference. And if it does, then it may be more likely to be on the contact or the inducible urticarias.
Insurance plans accepted, self-referrals accepted. You can make your appointment online at granitebayallergy.com. Dr. Patel, you're amazing. Thank you for coming in again.
Cool, thank you for having me.
We will have you back, as we always get follow-up questions, and then when's he coming back? When's he coming back? And until then, it's granitebayallergy.com.